Greetings. I am Tanya Abreu with Power Up Nursing, and welcome to another podcast episode. And this one is quite special as we are introducing an amazing health technology on the market that really is so closely aligned with Power Up Nursing's primary objective to protect and promote nurse well-being as the heart and the future of healthcare. Today, I will be introducing you to the medical science liaison of Alpha-Stim. And it is going to be a half an hour of information that you don't want to miss. We in the healthcare industry understand not just before COVID, during COVID, after COVID, but every single day what stress does to the human body. We probably understand it first in the patients that we serve, those that we know 95% is the estimate of all chronic disease comes from an origin of stress and anxiety. And so as we look to create and promote therapies that help us prevent anxiety, prevent burnout, and ultimately optimize our own health, every day we're learning about things that can help us with that. Today, I am going to share with you a device that very, very quickly, almost instantly, can help you, as they call it, take charge of your life. And that is something that we all struggle to do each and every day. So I am going to bring Dr. Ryan Gober into the studio, and welcome him as the medical science liaison for Alpha-Stim. Ryan, give us a little bit of an introduction to who you are, your background, and why you are dedicating a big portion of your career.
Yeah, awesome. Well, thank you, Tanya, for having me on today, too. So as you said, I'm our medical science liaison with Alpha-Stim. So what that really means is that I'm kind of the external voice for any clinical and scientific data behind our two devices that we'll talk a little bit more about today. Really excited to be teaming up with Power Up Nursing, too. It's something that we feel really passionate about. Healthcare burnout just as a major topic across, mental health right now, especially after COVID period. So, it's a topic we're really passionate about. So a little bit about my background too is before I started with Alpha-Stim's medical affairs team here, I actually received my PhD in neuroscience down here at the University of Miami. And I was studying behavioral health conditions, namely schizophrenia, bipolar disorder, and a little bit of major depressive disorder. And, as PhDs, we're always exploring kind of topics, especially seeking out what small molecules we can develop to treat psychiatric conditions. But during that time, I was able to do some clinical shadowing down here at Jackson Memorial. And during that time, I was
Also
really
a
able
Power
to
Up
see.
Nursing partner.
Yeah, exactly. I was really excited to see that too. But yeah, during that time, you really can't appreciate it until you get into that clinical setting. And I started to notice how important some of the non-pharmacological factors were in determining kind of the outcomes of patients with severe mental health conditions. It really kind of opened my eyes into realizing, hey, there's other modalities besides pharmacotherapy or drug options. So I became really interested in non-pharma approaches that could be digital health, brain stimulation devices, you name it. But that's kind of how I became interested in that topic. And I was really lucky to join Alpha-Stim's team because obviously we're a non-pharma option in the form of using non-invasive brain stimulation to treat mental health conditions. So it really was a perfect match. And now I'm happy to be working here with a product that it fits that bill, non-pharma, limit those side effects, and really can be used as a strong adjunct option to help reduce anxiety, insomnia, and pain, as we'll talk a little bit more about.
Ryan, do you have a device with you?
I do. It's actually in the other room, but I
Well,
can
you
grab
go
it.
ahead and get it. Go ahead and get it. I'm going to
Yeah,
give them a little bit of background on my experience with Alpha-Stim. And as soon as you
sure.
come back, I'll put you back in the studio.
That sounds great.
I wanted you all to take a look at this very compact. It comes in like a little kit. I called it the first aid kit for mental health. But I was introduced to Alpha-Stim a whopping 8 9 years ago when it was relatively new on the market. And I was an owner of a Medi Spa at the time. And we got it to really help people kind of relax and to use it pre various procedures they might have, whether it was plasma facials or biostem injections into knees and things that made people very nervous. And so we were very excited to be an Alpha-Stim spot. What was very fascinating to me is that once somebody tried this piece of equipment that had these two little clips on their ears, and I would set them up for about a half an hour, they came up to the front desk and said, "Can we do that regularly? Like, this is just amazing." And so we had people come in. We just bought an extra machine just in a quiet room for people to use as you would any other kind of massage chair, anything for relaxation. But what came out of it was relatively, I think, serious. We had people tell us that they were worried they were drinking too much. And then they started using the Alpha-Stim and found that they didn't need to drink, that they felt that they were happier, that they were sleeping better. And before you know it, we started to sell the Alpha-Stim as a courtesy to our patients. So it was delightful that I actually saw the CEO at a conference that Power Up Nursing was speaking at and said, "Oh my gosh, you're still here." And he said, "And we're improved and we're better," named Brian Burke. And so that's how we brought this to you today. And I am bringing, there he is, back online to show. There it is, the little fun device. Well, explain it, and more
Yeah, sure.
importantly, explain what it does.
Well, first off, sorry I didn't have it on hand with me there. It was actually in over across the house in my bedroom, so it does get used. I was using it yesterday. But yeah, so it's a very small, handheld, non-invasive brain stimulation device. So, of course, right off the bat, that does lend to some versatility. As we'll talk a little bit more about, it can be used in clinical settings as well as take-home settings, like we were talking about just now. But even though it's such a small amount or a small device, it's still very effective clinically in reducing symptoms of anxiety, insomnia, and pain. So the device itself, small handheld, it uses these small ear clip electrodes that you simply place, on your earlobes there. It's meant to be a very easy to train option for easy to train and easy to implement option for patients and providers alike, as we'll talk about with burnout a little bit more. But what you're doing is you're putting the ear clips on and you turn on the device, and it emits a very small amount of electrical stimulation in the microwave range. So many electrical stimulation devices are in the milliamp range. We use electrical current in microamps, so very small, sub-threshold, tiny amount of stimulation. It's applied through the ear clips, but we know based on study data that this current will make its way through cranial nerves and even through the skull and into brain regions that are heavily involved in anxiety and insomnia. So that's kind of how we're getting some of our mechanistic benefit there. And sessions are very easy to start. They can be as short as 20 minutes all the way up to 60 minutes, depending on the individual patient needs. So whether you're in a waiting room, you're in your own living room, or you're a provider that's just taking a 20 or 30-minute break between shifts, implementable option for sure.
I did want to say, and I talked a little bit about our usage a long time ago when I had a Medi Spa here in Florida. But just recently, we were out in San Diego, and I was with a nurse who was also presenting with us. And we all wear these ultra-human smart rings so that we can measure, not just sleep, but also measure throughout the day our heart rate variability and how we're dealing with stress. Well, Audrey Boyce is the nurse, and we both used the Alpha-Stim for a half an hour together. And both in our apps, we could see immediate, within 15 minutes, improvement in our heart rate variability, the indication that we are processing chaos and stress around us in ways that are not detrimental to our physical health. Audrey then called me the next day and said, "What in the heck is going on? I slept, my ring told me I had a 90. I've never gotten better than a 75." So she used it again and got the same results, and those results lasted for about a week. And then she went back to her old habit, not old habits, but she wasn't sleeping as well. And so she went ahead and went to her doctor to get a prescription for Alpha-Stim to increase her ability to relax at night. Now, one of the cool things is, Alpha-Stim is a prescription cleared for what we talked about, which was insomnia, anxiety, and pain. But if you, we also, I've heard that Alpha-Stim has ways, and a certain practitioner that will do telehealth to determine if this is right. I'm going to put up um, our website, which is Alpha. Is there a dash in the website, Dr. Ryan?
Yes, there should be.
Yeah, I'm pretty sure it is, but I'm just going to
Yep.
double check. Yes, there is. Okay. So talk to me a little bit about, all right, so we're saying that it sends micro electrical currents to the brain. That's scary. I mean,
Yeah,
that's
it can be a new concept for sure. And that's definitely one of our biggest uphill battles over the years. So the devices have actually been FDA cleared and on the market for several decades now. But it is always a little bit of an uphill battle introducing new patients and providers to what non-invasive brain stimulation is, because that can seem like a little bit of a crazy concept at first, or a new concept at least. So just how is applying electricity through ear clip electrodes able to modulate these large circuits in the brain? So can be a little bit of a learning curve there, but it's, the thing to remember too is we'll tell new patients is it's such a small amount of stimulation that very, very minute, very imperceivable at a lot of times. But even with that tiny amount of stimulation back in about the 2010 to 2013 range of period of time, there's always been this question of like, how can that tiny amount of stimulation actually affect these large brain networks? And during this time, there's a lot of research done to show that even this small amount of stimulation can alter the membrane potentials of single neurons. And then if you alter the activity of one single neuron, even just changing one neuron's activity can influence an entire brain network's kind of overall function. So that kind of lended itself to boosting non-invasive brain stimulation as a field in general. And now we're just kind of working backwards to try to like explain this in layman's terms to new patients and providers.
Okay, I'm trying to understand. All right, let's talk about this because there are a couple indications. All right. I think most of us and I have used this a lot. But I had a break. And the last time I used it was out in San Diego. And I thought, oh, I'm a big girl. I'm going to put it all the way up. And I felt it in 30 seconds. I felt like, whoa, I just had a half a bottle of wine. Right. So talk to me. And then when I scaled it back, it really felt like, wow, this is what it means to relax in the middle of a conference, right? It was foreign to me, right? So tell me how that works. I put those electrodes where I had my earrings, took my earrings off, put that on instead. And immediately when it was too high, which you could probably work up to, I felt a little discombobulated, a little dizzy, a little wow, almost like you do when you drink, okay?
Yeah.
Which too much. So that was a shock to me. But then when I sat down and Mr. Burke scaled it back, I was like, whoa, this feels like vacation. And actually, Audrey said, I feel when I'm on the beach. So how does that work? Tell me, how does that work?
Well, first off, that's a really funny depiction of kind of what the first time experience is. We'll get that a lot too. We get that same exact type of relaying of that experience where it's like some people describe it as a heavy glass of wine, exactly kind of that sinking into the couch type feeling if you're even taking a psychiatric drug, for example. So there is a very tangible effect even during that first treatment. And scientifically, what's causing that is when you start to use protocols with the device, they're really easy to follow, but the general protocol that will tell patients is that you start at the lowest stimulation amount once you put the ear clips on, and you start to bump the stimulation up as you did until you get that kind of rocking sensation, even mild dizziness sensation. And it's very, very noticeable. I think that's one of the biggest things where seeing is believing with a device or a therapy. We heavily encourage everybody to try it just so it looks like something that wouldn't have that big of an effect, but once you try it, you actually experience that. But what's happening is at that level, when you feel that rocking sensation, so we talked about the cranial nerves are some of the part of our mechanism of action, how the device works. But we know we're passing through cranial nerves that are close by to those ear clip electrodes, and one of them is the vestibular nerve. So it can kind of sound mystical if you tell a patient, like, turn the device up until you start to rock or feel dizzy. What we're really saying from a scientific standpoint is turn that device up until you get vestibular activation, since we know that's a cranial nerve that's involved. And it's not necessarily a harmful reaction. It's a natural perception of that nerve being kind of stimulated there. But then we bump it down 1 or 2 levels, as you did, so that it's a comfortable treatment. And now each individual patient's different. Some of them like to go past that cranial nerve threshold and continue treatment on there. I'm one of those patients where I actually enjoy the rocking sensation and kind of get a sleep latency effect out of it. So I'll actually use it on the highest setting. But for patients that are new to it, and it can be kind of a daunting experience, that's when they bump it just down below that vestibular threshold and treat for the next 20 to 60 minutes.
Well, we know that nurses and other healthcare providers, and it's one of the reasons why we partner with Ultrahuman, have a really hard time staying healthy because of sleep, because of insomnia, because of not being able to quiet their
Right.
thoughts, not being able to reduce just the anxiety of, did I take the garbage out? I mean, not even the big anxieties of patients and life and finances, but little things can keep you up all night. How does the Alpha-Stim work on insomnia?
Yeah. So insomnia, I guess we should first start off by looking at the other parts of the mechanism. One of them, for kind of that instant type effect, is that not only are we interacting with the vestibular nerve, which gives us that very kind of a noticeable rocking sensation we were talking about, but within that too, we also interact with the vagus nerve, which is it infiltrates the ear through the auricular branch. So we do get some interaction there. As you mentioned, there's heart rate variability data to back that up, as well as what you're monitoring with your ring so far, which is really actually cool to hear that real world too, not just on a clinical study. But we're interacting with that nerve, which is how we get some of that acute effect. So vagus nerve stimulation has been a hot topic. But then for insomnia, we're also able to show with EEG and fMRI data that the stimulation not only passes through these cranial nerves surrounding the ear, but makes it through the skull and into the temporal region of the brain, or temporal lobe of the brain as well. So really cool study to show that we're able to hit that brain region, and that brain region is involved in the default mode network, which is shown to be overactive in both anxiety and insomnia. So by getting our stimulation to that brain region, it acts as a circuit breaker and breaks up that kind of overactive brain network there. And that the default mode network is involved in those ruminative thought patterns that you were describing as well. So kind of those, those anxiety-inducing ruminative thought patterns, you just kind of need to reset a little bit. But that's the kind of scientific basis of how we're getting our efficacy in insomnia too.
Wow. Wow. And what I want to speak to for the nurses is that we know a lot of devices claim a lot of things, but they don't have FDA clearance to really talk about them. And what I like about Alpha-Stim is, I can say this, you can't, Ryan. There's lots of research on this type of brain stimulation for things like addiction, depression, things that really hurt our ability to function every single day. I mentioned that in my Medi-Spa, there was a woman who particularly finally ended up buying one, saying if she came in on Friday, she drank less over the weekend. And we know that lots of these things are associated with anxiety, right? If your mind can't stop, it seeks to self-medicate. And so Alpha-Stim, in many ways, like you started, Dr. Ryan, by saying it is a non-pharma approach to reducing anxiety. But there's a big thing that it does that has FDA clearance for, that I really want you to dive into, and that is pain. I hurt my knee. Now, is this a TENS unit? Like, we know in healthcare that you can get TENS
Right.
units, put electric current into my knee, and it helps for like the time it's on there and maybe 20 minutes after. How is Alpha-Stim different? Because I think there's 2 models, right? There's one that comes with electrodes for the body part that hurts, Please explain.
Sure. So yeah, that's a great question too. And the pain indication, does have some overlap there. And I thought it was a great thing that you brought up TENS units because that's something that a lot of providers already have familiarity with, and we do share some mechanistic overlap with those as well. But as you mentioned, the device itself, like this is it with the ear clips hooked up right now, but there are also additional ports that you can plug in these hand-based probes. They don't like to show up through the filter too well. But essentially, you can use these probes to then target different levels of the pain pathway using the same stimulation that we're applying through the ear clips. But its overlap with TENS is that there is that acute effect. So it has a lot of similarities in the fact of how the current's being applied. You do get that instant relief like you would with a TENS unit, but there are some key differences too. With TENS units, you're usually in the milliamp range, so this will get a little technical, but you're using a heavier amount of stimulation. Because if you're familiar with TENS units, it can cause muscle contractions and kind of increase blood flow through those mechanisms. So we're using a smaller amount in that microamp range. So a lot of patients that don't like those muscle contractions will turn to Alpha-Stim as an alternative to applying the stimulation, but it's subthreshold, so you're not going to get those uncomfortable contractions, but you'll still get the acute relief. So that's on the acute side. But then with this device too, it's also capable of using the CES ear clip method. So same device, you can do a treatment on the pain pathway itself, that acute and localized pain. But then we really encourage patients that also have comorbid anxiety and insomnia that often accompany chronic pain to treat with the CES ear clips right afterwards, because we know that kind of this positive feedback loop between anxiety, insomnia, and pain can really kind of accentuate those symptoms for long periods of time and kind of degrade on overall longer term outcomes. So that's how we think that we really get some of our stronger long-term outcomes compared to a TENS unit alone.
Interesting. I'm putting up another banner because I do this so that I can go back and see the notes that I'm sharing. I like this whole concept of anxiety, insomnia, and pain can be seen as a single feedback loop. We have another, and she's on our board and a founder of Power Up Nursing. Her name is Dr. Alba Rodriguez, and she also as well, a PhD neuroscientist, who says that you really, acute pain is one thing, right? You cut your leg, you feel that acute pain, but chronic pain is just aligned and integrated and inseparable from stress and anxiety. That, once you take away stress and anxiety and you give people ways to deal with that, all of a sudden they'll say, oh, my back doesn't hurt anymore. Almost like, you're healed in the moment kind of thing. So that seems to be, you have operationalized that work with Alpha-Stim.
Yeah, absolutely. And that's a great point too. It's we know that anxiety and pain, they're all kind of cross-talking with each other. We know that people with heightened anxiety can also have heightened pain perception. So if you have higher levels of anxiety, especially associated with that pain condition, it can really exacerbate that signal as it approaches our brain and the overall experience of that painful stimuli. So definitely a positive feedback loop. So having an option that is probably our biggest separator from other TENS devices is having an option to target those mental health components of chronic pain as well.
Now, I understand that, and I don't know if you can talk about it, but I understand that Alpha-Stim has been doing a lot of research and has been active with PTSD with our veterans. Can you talk? We have a lot of healthcare providers who are also veterans facing PTSD and other anxieties derived from those traumatic experiences. Can you talk at all about that, or is that not something that you're comfortable with?
Yeah, so we're a little bit limited by our labeling, but I'm happy to expand on it as far as I can. One thing is PTSD indication was the diagnosis criteria were changed during the DSM-4 to 5 transition there. So our clearance for PTSD no longer falls under that anxiety umbrella. But with that in mind, too, the device has been available for quite a while and used in veteran affairs hospitals, for example, quite heavily. So you can imagine with that population, there are a lot of providers that will use it in that capacity. And for anybody that's listening to that is interested in that indication, I think we'll probably share my contact information with this afterwards. Reach out to us directly, and there are studies that have become available over the years in that indication, and I'd be more than happy to pass along kind of one-on-one those resources as needed. But again, even if we want to look at PTSD by itself, we know that comorbid anxiety is a huge factor in their outcomes as well. So that's always one way that we'll look at it.
Wow. Okay. Yeah, I think it's all so intricately overlapping, right? So let me ask you this. What is the long-term benefits? All right, there's two groups of people listening. One are healthcare providers that are saying, okay, Ryan, how would I use this in my practice? So can you address that question first?
Yeah, so it depends on what your practice is, and that's the beauty and the curse of having these three different indications that are such vast patient populations, is that there's tons of different implementation models depending on what patient population you're dealing with. So one thing is, we know on the psychiatry side that patients with chronic anxiety or insomnia. So if you're a psychiatrist and you have patients coming in that report these chronic symptoms of anxiety and insomnia, it's usually best to prescribe it out to them so they can take it home to manage those chronic symptoms. But then we also know that there is this acute effect as well. Like as you pointed out yourself, when you wear it for even 20, 40, or 60 minutes, you can experience some of those acute anxiety reliefs as well. So we use it a lot in the pre-procedural anxiety context. So if you're a provider that is using a technique in your practice that can be anxiety inducing in itself.
Or
You
dentists.
can, yeah, exactly. You can use it before that procedure is performed. So we have a really nice clinical study showing that we're actually able to be just as effective as midazolam in treating anxiety before surgical procedures.
Wow.
So yeah, really interesting finding that you can go toe to toe with the benzodiazepine even as a non-pharma option within that acute window too. So that's one implementation model that we'll see a lot of. We use it for pre-dental anxiety, even pre-TMS anxiety. You kind of name it. If there's a pre-procedural anxiety component, you can plug and play it pretty easily if you just give that patient the 20 minutes before that procedure to use it.
Okay, so that's good. Now, what is the cost range to a machine? And I want to say, because I had somebody that I talked to about it, and they went to their insurance company, their medical insurance, and their medical insurance is picking up like 60% of the cost, which I think is really great.
Oh,
So
that's
it
great.
is considered by some insurances, a durable medical equipment, right? DME.
Yep.
So depending on your benefits, it can cover up to 80%. In this case, it was 60%. I think the range is what? Is it $800?
Yes. So for the device that's FDA cleared for anxiety and insomnia, that one's going to be 840, and then the device that has the pain clearance as well bumps up into more of the $1,100 to $1,200 range there.
Okay.
So a
Okay.
little
So
bit of a bump up there, but and then in terms of insurance, you bill it through DME as you mentioned, and what we'll generally tell providers to tell their patients is that the most that you're going to pay for, let's say the AID device, the one with the anxiety and insomnia clearance, the most you're going to pay for it is up to 840. When you bill through DME and then seek reimbursement on private insurance, some of them will pick up a portion of that, as you mentioned, but to be safe, we'll tell patients this is kind of the maximum that you're going to pay. And in the scheme of things, too, for a chronic condition, an $840 medical device that costs less than a laptop really is not. If they're experiencing clinical benefit from it, you usually won't get a lot of pushback.
yeah, and especially if they have a provider that can actually let them use it a few times,
Yes.
like we did. The other thing that I wanted to talk about is that, are there cumulative benefits? Does the brain have like a muscle that learns how to feel better after it's stimulated, over a period of time?
Yeah, that is a great question. So we kind of look at it as this kind of durable response. So that's exactly what you're going to want to see. Is this something that these chronic patients with chronic anxiety can use as a long-term solution? And we'll say that the response is durable because we have studies that have gone out to 5 weeks, but we've also had studies that have gone all the way out to 3 and even 6 months. And what we've seen in those studies is that, first, the critical period is going to be that first 1 to 5 weeks where you want to treat daily at that point, because we know that we get an 83% response rate in patients with chronic anxiety within that first 5 weeks of daily treatment.
What is that again? 83%? 83% say there's a reduction?
Yep, clinically significant reduction. So a reduction of greater than 50% on their Hamilton anxiety scores within that first 5 weeks. But then after that, so we've looked past that time point, and we know that you can still continue using it daily, but we know that patients that don't use it daily, so maybe they'll only use it a couple of times a week, it's not like missing a medication dose where those symptoms come back immediately. If you miss your insomnia medication that night, it's probably not going to be a great night's sleep. But we know that even if they miss treatments from switching off of that everyday routine, that the symptoms don't immediately come back. So even after one trial of 3 months of daily treatment, patients turned their devices into the trial center and came back in weeks later for a follow-up and still maintained those benefits. So there is this kind of
nurse I told you
durable,
about.
yeah.
She went a
And
week.
there's tons of different mechanisms that can lead to that too. If you can appreciate, if you have significant anxiety, you're probably not interacting with as many of healthy lifestyle options at that point too. So if you come down into a healthy symptom range, you can pick up some of those kind of healthy, positive feedback lifestyle choices as well. So whether that's being more social, confronting the symptom, or confronting the situations that were giving you anxiety in the first place, and there's a lot of different mechanisms that could explain that durable effect too.
Oh, that's just so exciting. We're running out of time. We don't like to keep our listeners too much over 30 minutes. But I want them to have the opportunity to consider this. Alpha-Stim.com is a place to look at some research and understand what it is. And we are committed as a Power Up Nursing Network to partnering with Alpha-Stim to put this amazing durable medical equipment in the hands of both our providers and their patients. I would suggest that you explore. You can also use flexible spending accounts, healthcare dollars, and you can set them aside and use them to purchase a unit. It's very, very exciting time in the world of chronic disease, chronic stress, chronic pain, and of course, insomnia and fatigue. I appreciate you being here, Dr. Ryan. Is there, I think, I can't remember who told me, but there is telehealth available at alphastim.com if people don't want to go through the hassle of going to their own primary care provider, if they can get an appointment. How do they
There
do
are
it?
some options for that. So we'll typically set you up with a local rep that can point you to some of those telehealth resources in your area to get set up on it.
Who do
But
they
yeah, but
call?
then
Is there
even
a
after
phone number?
that, what's
Is there
that?
a phone number? Is there a phone number?
There is. It should be on the Alpha-Stim website. If you go there, it'll be right there, front and center. You can
All right, I'm
also
going to try
use
to
their
find
general
it so I
email and
can
get
share it.
redirected.
Can share it with our people. Yes, let me put it up so they don't have to do this work, and I will do it for them.
Yeah.
There you go. And let me put it on the screen. There's the number, 1-800-367-7246. I encourage you. I actually have a prescription out. I went to my primary care provider, who is like so interested in this now. The fact that it's FDA cleared, the fact that she has so many patients that can't sleep or that want to be on medications that she doesn't feel comfortable prescribing. So she's excited. So she did her research. Like, she wouldn't just write the prescription. So I sent her to the website. And actually, if you call this number, there is materials that you can give your doctor that Alpha-Stim can provide you, because we've provided some nurses with that. I am so thankful to you, Dr. Ryan Gober. Let me show your name for your insight, for your experience, and for your commitment to really protecting and promoting well-being for Americans. And we are excited to start this partnership. If any of you who are listening, go ahead and get a device. I wish you would please get back to me. Let me know how it's going. We thrive on that feedback, and we always share it with our partners. You can always reach us or any one of us at info@powerupnursing.com. Put that up. And again, have a beautiful, healthy rest of your day whenever you're listening to this. And let us know what you think of Alpha-Stim. Put it in the comments. We are on YouTube, we are on Facebook, we are in LinkedIn, TikTok, and Instagram. We love you and we appreciate the science behind Alpha-Stim. Thank you. Thank you, doctor.
Yeah, well, thank you so much for having me too. And yep, definitely reach out with any questions on scientific, clinical. We're just happy to be part of this partnership, and we think there's a lot of opportunity moving forward.
Thank you.